Well, still on health news, it was a red letter day for healthcare in the country today as the National Health Secretariat released the request for proposals for a public insurer that will oversee the program's primary care phase. The RFP describes in detail the services being sought, the submittal requirements, and the evaluation process. Janae Noel Ferguson covered today's NHI press conference, and she tells us how officials also discussed the way forward.
The National Health Secretariat has asked for bids from around the globe, including local insurance companies, to submit proposals to manage a public insurer for NHI. The move marked as another milestone in the road toward NHI. Secretariat officials noted that the passage of the NHI bill sets a framework for the program. NHI Secretariat Peter DeVoe-Isaacs.
A wholly government-owned and operated, fully licensed insurance company to manage and administer the benefits under the NHI plan. A single contract will be awarded through this RFP process relating to public insurer. The government is seeking an experienced provider to provide third-party management, administration, and wellness services for beneficiaries.
And while there has been concerns about job losses and a negative impact to the local insurance company, consultant of the National Health Insurance Secretariat, Damara Dillett, said it's hoped that a public health insurer would level the playing field.
The public insurer will only administer NHI benefits. Any benefits above and beyond that, we refer to that as top-up or supplemental. That top-up or supplemental aspect will exclusively be available through the private insurance industry. The public insurer, will not take part in that particular market. It will only exclusively administer NHI benefits.
Now, during debate on the NHI bill, opposition members argued over funding for catastrophic care. Dr. DeLon Brennan explained that a startup fund of $24 million has been allocated to facilitate such cases. But is it enough?
What we're saying is this is additional funds that we haven't had available to us before that we'll be able to use for others who weren't able to get care. But now we're going to figure out a system of how do we get people into that funding system, but also making sure we integrate all care across the system so that beneficiaries will still be able to get care, whether at the PMH, the RAND, or at other healthcare institutions in country, using funds we already have in the system.
Now, Dr. Brennan clarified that there will also be the removal of the $10 fee for Bahamian nationals at point of care.
But in addition, when NHI comes in, not only does it allow for those services to be delivered at point of care without the need for payment in the public sector, but it also does so in the private sector. So if you wanted to go to your private sector provider, whether physician, nurse practitioner, and get those services provided, if you wanted to get to a private lab and have your labs done there, private diagnostic facility, if you wanted to go to a private pharmacy to get your medications, you could have all of those things done, public sector and private sector, using your NHI card with no need for payment.
Now, qualified and interested bidders should submit their proposals to the NHI Secretariat by October 7th of this year. Janae Noel Ferguson, ZNS Network News.